Welcome back, and in case you're just joining us, the National Coordinator, National Center for Disease Control, Professor Nasidi Abdusalam, is our guest on Question Time. What are the early warning signs of this Ebola virus?
That is what nobody can tell you yet. There's no carrier state for Ebola virus. When we say carrier state, it means you have the virus and you are not sick and you are walking in the public. But Ebola virus, you can't have it and survive without symptoms or signs after 21 days. So between 7 to 21 days, you must either become ill, or you are cured, or you are dead. So we don't have carrier status with Ebola. But nevertheless, the signs, of the early signs that somebody could be having Ebola is the fact that he will be having high temperature, symptoms like malaria. I don't want to repeat them. Same symptoms then with diarrhea. And the unfortunate incident, unfortunate aspect is that people take it for granted. It comes like a biphasic disease. That means it comes in two phases. Phase 1, you have all the symptoms that I've mentioned: high fever, diarrhea, joint pains, whatever, all the symptoms, abdominal pain. And the patient can improve. Maybe after 3-4 days or 1 week, then all of a sudden again, he goes back again into a series of symptoms, becomes delirious, that is confused, and headache and all this, and then that means the virus has hit the brain. In most cases, people don't survive after that stage. How would you assess Nigeria's research efforts so far in checkmating the spread and also in fighting against, in the prevention of this Ebola virus? Yeah, I must say that at least this is something that we have succeeded in doing well and teaching the world. That we rose to the occasion when this appeared in Lagos, and we came together jointly with the federal, state, local government. Everybody came in, traditional rulers. This is what really united Nigerians, and we came together, irrespective of party, religion, and we fought this disease very well. And what did we do? Is to quickly be ahead of the virus. Don't allow the virus to escape into the community. So we managed to, within a short period of time, interrupt transmission of the virus between first and second contact, primary and secondary contact groups. And that is history. That is very important. How did we do it? Many countries want to learn from us, and we've been teaching many countries. And as I'm talking to you now, we are now using that system to improve the surveillance for other diseases. In fact, the method used by Nigeria, which was actually adopted from other surveillance systems that we've been doing before, is now been developed, co-developed by us to a higher level of surveillance system, which will be used by many other countries in the world. And we're doing it jointly with German experts from Robert Koch Institute in Germany. And we are also collaborating with the US CDC to develop other aspects of disease response. So what did we do? What we did was to quickly respond within the shortest period ever. And for you to be effective in Ebola control, you have to be very, very fast and, how will I say, punchy in dealing with what you have to do. So generally when you have emergencies, if you want to save lives or mitigate the impact of that emergency, then you have to have the most minimal response time from the time that emergency appears or reported to you and to the time you responded. Nigeria responded within 24-48 hours, and we didn't relax. From that response, we made it maximum, established what we call Emergency Operations Center in Lagos, and coordinated it very properly. Now, reviewing what it takes to sustain the costs and also the logistics of sustaining this emergency response and containing Ebola, do we have what it takes? That is what the area we went a little bit relaxing. We relaxed that aspect. We did it so well with the Lagos State Government, River State Government, where this appeared. And surprisingly, one thing that I must say is the leaders of the country rose to the occasion. Instead of us looking for advocacy to go and see the president, to see the governor, both the president and the governors, of Lagos State, of River State, empowered, the team to make sure that we were ahead of the virus.
But do we have enough manpower to handle these potential threats?
Yeah, well, in terms of different levels of manpower, we said, Nigeria didn't have enough medium level manpower. As the Nigerian Center for Disease Control, that's our assignment to train more. So we upscaled our training, and together with the University of Ibadan and Ahmadu Bello University, we are running this program. And each year we are training about 60 experts to the level of masters in public health. So we are building that manpower volume. But the next is, actually empowering those who will work at the grassroots level and, local government level. And, this requires a lot of resources, a huge amount of money, materials, and facilities. So we are working not only with the state governments and the local governments, but we're working with other agencies in the country that can co-fund this project. We have written that proposal. We have submitted it for funding. We have written some application for grants. We pulled out of Liberia, Sierra Leone, and Guinea too early. There might be need to go back quickly and do what we call the blitzkrieg. What the Germans call the blitzkrieg, that is sudden attack, to really wipe out the virus and become relaxed.
You can join in this conversation by sending us your comments on our various social media platforms showing on your screen. Coming up on Question Time, could anyone tell us what happened to the 1.9 billion naira Ebola Intervention Fund amidst raging allegations? Find out after this break.